I think it's important for us as a community to understand that this thing is not going away, that we're going to be living with it until we have an effective vaccine which is widely available, and we simply should not be willing to take significant risks of upsetting the balance.
Now that Austin parents can circle the first day of school on their calendars, Austin Public Health says it's looking at other upcoming events that could lead to another drastic COVID-19 spike. Good afternoon, and thank you for joining us here at 4:30. I'm Robert Hadlock.
And I'm Sydney Benter. It's not just the beginning of the new school year that has Austin Public Health concerned about a potential spike in coronavirus cases.
During today's Travis County Commissioners meeting, Austin Travis County Interim Health Authority Dr. Mark Escott looked ahead to more possible pitfalls. Among those, Labor Day, which falls on Monday, September 7th this year. That's the day before the first official day of school for the Austin ISD. Escott says potential mass gatherings during that weekend, much like on Memorial Day weekend back in May, could undo any good that's been done to flatten the COVID-19 curve.
And Dr. Escott also brought up football, which we'll discuss in depth with Roger Wallace in just a few minutes. Mass gatherings at sporting events is one of the reasons Escott and Austin Public Health is recommending schools open at 25% maximum occupancy, regardless of the risk level at the time when campuses eventually open.
I think doing things in a slow and methodical way is going to help prevent the surge that we may see if we just pack students back into schools, in August or September.
Escott also says that Austin Public Health's newest COVID-19 data shows that young children do remain in the least affected group by the virus. There is still what he calls high activity among that age group when it comes to hospitalizations.
About 2.7% of hospitalizations this week were related to that 10 to 19 age group. You have seen that across the country there's been a significant increase in the number of school-aged individuals who have contracted COVID-19. So we continue to pay close attention to this age group as we get close to September.